there, this is Allison with Virtual ICU.
I think the main difference between day shift and night shift is the extra support from other services and disciplines that aren't at the hospital during the night.
Of course it's different. We're like vampires. I started working on the day shift because they wanted me to orient and see how the hospital flows in the day before I went to nights. It's a lot more hustle and bustle, a lot more providers to interact with, and more family for sure.
Because there's only one intensivist overnight in the hospital, multiple emergencies can happen with patients during the night. Having the virtual ICU intensivists on call for us definitely provides a safety net of support. On day shift, they have multiple disciplines working with them throughout the day to advance care for the patient, from physical therapy, occupational therapy, the various consulted physicians of all different specialties. Whereas at night, we primarily rely on our nurse practitioners and our overnight intensivists that are here at the hospital. Those intensivists only cover the ICUs as needed, mainly for emergency purposes. My name is Daniel Prieto. I'm a nurse here at Houston Methodist Neuro ICU on night shift. I started working here in June after graduating nursing school, so I'm still in my first year of nursing. Any pain or tenderness?
I can feel it, but it doesn't hurt.
Good. Multiple emergencies can happen with patients during the night. We don't feel as isolated or that we're sort of on our own as much, knowing that they are just a button push away.
Hello, Allison. We're trying to get in touch with Dr. Nguyen.
Okay, hi, this is Dr. Nguyen here.
Very good, Ms. Barron. My name is Dr. Nguyen. I'm actually one of the ICU doctors in the neuro ICU, but I also do virtual coverage here, okay? How are you feeling this evening, dear?
Feeling good.
That is very, very good. Obviously, every brain surgery.
Having virtual intensivists, I think, has been a great thing for patients in terms of safety and also just sharing knowledge as well. Intensivists, we come from different specialties, whether you're cardiac, whether you're neuro ICU. And having virtual intensivists with these different specialties, now we can actually have a greater outreach to our patients in our different hospitals. My name is Dr. An Nguyen. I'm one of the neurointensivists here at Houston Methodist. I'm also a virtual intensivist here at Houston Methodist. So a lot of times it's because there's an issue in the ICU, whether the patient's blood pressure is low or heart rate's high, etc. I camera in and I introduce myself, look over the vitals, examine the patient with the bedside nurse or the provider that's there, and see if we can diffuse the situation there. And the goal here is to provide a added safety net, if you will, to our teams. We still have the providers on the ground, and then the virtual intensivist is added as a layer to help with any questions and to help patient care. Virtual ICU nurses, their main job is to make sure that all the nurses feel supported on the ground. They also monitor a lot of the patient vital signs, whether it be blood pressure, heart rate, oxygen saturation, and to notice any trends that seem abnormal. They also have their hand on the pulse of all the patients in the unit that they're assigned to. And so a lot of times they pick up a lot of the vital changes before even the bedside nurse. The virtual nurses are irreplaceable. They are some of the best and brightest nurses, and I'm lucky that I had a chance to know and work with them.
Sometimes we'll camera in and the nurse will be alone in the room with the patient. Let's just say the patient loses a pulse. We'll be in there in the room, we're like, let's start compressions, and we'll get the code blue going while another team member here calls for help from the virtual doc, and they can camera in while the NP and the bedside team is getting the crash cart and coding the patient. So we work together as efficiently and quickly as possible to really help the bedside team. We might not be there physically, but we serve to be a resource for them and to provide the knowledge that we have, the insight that we have, to be efficient and effective to take care of that patient as quickly as we can. My name is Allison. I am a virtual ICU nurse here at Houston Methodist Hospital. I've been an ICU nurse for 8 years now, And I actually was part of the piloting of the virtual ICU here at Houston Methodist. I joined Houston Methodist virtual ICU program as a full-time staff for about 3 years now.
When I was first a new grad, there was a patient that was coding, and the nurse practitioner let the intensivist run the code through virtual ICU. So the nurse practitioner was definitely there to still make sure other things were in line, but the intensivist was on the camera and giving us all the orders, and the nurse practitioners and the nurses were just telling the intensivist what the patient looked like, current vital signs, everything that we would do during a normal code with the intensivist at the bedside, but they were virtual. The intensivists, they're very knowledgeable and they've gone through codes so many times, and just with us verbalizing our assessment and letting them know and them seeing like what they could, they knew exactly what to do. I'm Claire. I work in the Neuro ICU in Walter 11 in the Houston Methodist Hospital. I'm a new grad, so this is my first nursing job. It's been about 6 months.
Hi there, this is Allison with Virtual ICU. Did you guys call?
Hi, Miss Allison. My name is Claire. I'm the nurse for Miss Cooper here. I was wondering if I could get in touch with Dr. Nguyen.
Hi, Ms. Cooper. This is Dr. Nguyen, our virtual intensivist, and this is Claire, the bedside nurse. I get to see a diverse array of patients with neuro issues, with cardiac issues, with medical issues, patients who have been post-transplant or waiting for a transplant. We do get involved in those patients' care as well and are able to utilize the knowledge that we have to assist the bedside team in taking care of that patient, because I'm still able to look at their vitals, analyze their labs, help with medications or suggest medications adjustments in order to really optimize the care for the patient. Your blood pressure is looking so much better. Yeah, we want to definitely keep your blood pressure tightly controlled.
Yes, ma'am.
Yeah, especially after the angiogram you said you had, right?
I think the future for virtual ICU is bright. I think we will expand further and further to areas and satellite hospitals that are in shortage of intensivists and of physicians. And I think this way we will be able to care for more patients in need.